touch on some topics in terms of COVID this morning. So I know that we got back the test results from Carrefour. Can you shine some light on that?
Well, thank you very much. I think that's a very important question and very topical. As you know, we were running a backlog of about 1,000 samples last week, and we have taken some steps to try to clear that backlog. Among the steps that we have taken, internally, we have been running more shifts at the National Public Health Reference Lab. So we have been taking care of some more samples with our current capacity. But by increasing the shifts, we are able to do more. And so we have been doing that. Plus, of course, we sent 500 samples to CARFA, and we are now getting back those results. So one of the things that I want to explain to people, now that we are getting back the results of those 500 tests from CARFA, plus the testing that we have been doing at our lab, when you combine the two things, we are actually seeing many more positives because it's a larger volume of samples that we have processed. So when you see the new results on the dashboard, you would see an increase in cases. Now, that is not what happened in the last 24 hours. That would have been for samples that were taken a couple days ago, but we have now gotten the results, and therefore you would have seen that spike. So it's, it gives us an indication of how many samples and how many positives we have, but because we are only now getting it, these should have been done earlier, so to speak. Maybe I didn't explain that too, but probably. Yeah. Ask back the question. Let's go again.
So, good morning, Minister. We're here with you this morning to address some pertinent matters as it relates to COVID. One of them being the backlog of cases. Can you shine some light on that?
So with the backlog, we have two main approaches. One, the current capacity at the National Public Health Reference Lab. We have worked to increase that capacity by putting on extra shifts and so forth. So we can process locally between 250 to 300 samples per day or in a 24-hour period. And in addition to that, we have established a relationship with CARFA where we have sent 500 samples to CARFA to be processed. We have started getting back those results from CARFA. We started 2 days ago to receive those results, but we haven't gotten all of them together. We have been getting them in batches, maybe of 50 or so. And as we get them, we are incorporating them into the results that we are showing to the public. I think yesterday we received close to 300 samples back from CARFA. So when you see that being integrated into the dashboard, you would see a spike, and therefore you probably see maybe a higher number than we are accustomed to. I think every day we'll probably see maybe about 20 to 30 positives going on the board. But maybe today or tomorrow, you will certainly see a spike because it's not 100 or 200 cases. It's now 500 plus the samples that we have done at the National Public Health Reference Lab. So I just want people to be alert to that. Don't be too alarmed because this is the accumulation of cases over a number of days and does not represent what happened in the last 24 hours.
So, Minister, with plans going forward in terms of testing, the last time we spoke, you indicated that you were adding capacity to the lab. Do you have any updates on that?
So there are a couple of things that we are doing to build that capacity at the National Public Health Reference Lab. Instead of having one machine work all the time with 3 shifts, we are planning to put at least 2 other machines. So we'll have 3 lines working continuously for 3 shifts. And that by itself would create a lot more capacity for us. So we are in the process of establishing the other two lines. That require that we have some biohazard cabinets and so forth in place, and we have start making the arrangements to bring in the expert to certify the cabinets. Cabinets and everything are already in the lab. It's now to get the certification of those cabinets, and hopefully by this week, those arrangements would be sorted out. In addition to what we are doing at the National Public Health Reference Lab, we have looked at another site, and we are also doing the same in terms of ensuring that all the equipment that is necessary to do safe testing, that is also in place. And we have been talking to the private sector here to see whether or not they can add some capacity in the private sector. I know there are a couple of initiatives that have started, and I think very soon one of the private hospitals would be able to offer PCR testing as well. So that's one area where we are trying to increase capacity to take care of the backlog that we have. The other thing is that while the initial arrangement with CARFA was supposed to be a one-off arrangement, we have now spoken to CARFA, and we are sending additional samples to them. So this morning, we'll be sending 138 samples to CARFA, and we have spoken to them maybe on an ongoing basis, at least every week, to have some amount of samples going to them until we have our full capacity up and running. So that's one avenue that we are looking at. We have also explored some other options of sending samples to other labs so that they can process those samples for us and return the results to us. So these are options that we are currently looking at, but as you would understand, if we send samples to private labs, there's a cost that we'll entail, and that's something that we also have to look at. How much that would be costing us to process, and whether we'll be able to afford that on a long-term basis. But all of these arrangements that I've spoken about, this is just an interim arrangement so that once we get up and running at the National Public Health Reference Lab, these arrangements would become redundant. So that's one area that we are looking at. The second area, because to do a PCR is a very cumbersome arrangement, taking sample, processing sample, the time it takes to do that, and so forth. But the test is the gold standard in terms of making a diagnosis for COVID-19. The other area that we are looking at is to have what is called some point-of-care machines, where we are testing for the antigen itself, but these tests can be done more in an outdoor setting, not outdoor, but maybe in a clinical setting, and they're faster. So they'll give you a greater appreciation of what is happening with the patient, whether they're positive or not, and that can be a good indication. If we have any doubt, then we will then revert to the PCR testing. But it would help us to be able to make a better diagnosis quicker. And so we are trying to get some of those machines in. We have been talking to a number of companies who are manufacturing these types of machines. We haven't concluded those discussions, but it's something that is currently ongoing. And if we get them, that would help us tremendously at the regional level, because we'll be able to do those tests out in the various regions, especially in the hinterland region, and we'll have a faster return time and be able to make better clinical decisions in these regions.
Okay. Well, speaking of regions and on the topic of capacity, how are we in terms of regional capacity?
Well, we have strengthened our regional response to the pandemic, and in regions where we have seen a surge in cases, we have been sending additional medical personnel, both doctors and nurses and other personnel, health personnel that is needed to bolster that response. So we have sent in extra personnel to Region 9, to Region 7, to Region 8, Region 1, because we had, at varying times over the last month or so, we've had some challenges with increase in cases. So that's one way, increasing the manpower, sending in people with the know-how to assist the team that is already on the ground, and we have been doing that. In addition to that, we want to make sure that these regions have the PPEs and so forth to be able to protect themselves while offering care. And we have increased the levels of PPE stock that we provide to the region so that they can have adequate amount of PPEs. Consumables, medicines, and so forth, we have been working with them to ensure that they have that as well. So this would be for more the mild cases, moderate cases that we're working on. We have also, in terms of isolating patients, in some of our hospitals, as you would imagine, regional hospitals, they're not huge hospitals, and therefore the amount of bed space that they have can be limited sometimes. We have worked to improve that by providing them with isolation units that were donated by the UN. And so we have set those units up near all the major regional hospitals. So we have in Region 1, in Mabaruma, we have in Maruka, we have in Region 7 in Barkika, we have in 8, and we have in 9. So this has increased our capacity to be able to isolate patients. Now, we are also planning that if we have patients that would require critical care, that we build that capacity in the region. And so in anticipation of building that capacity, we have already started doing training with the medical doctors and some of the nursing staff, talking about the medications to be used, and of course, training people on the use of ventilators. These courses have been run by the consultants at the Georgetown Public Hospital. The one dealing with ventilators and how to ventilate a patient and so forth, that's an ongoing course, and maybe sometime during this week, the first batch would have completed the theoretical component of that. Then we'll be required to bring them out to have some practical training so that they'll have hands-on experience, and when they have such a patient, they will know exactly what to do. In addition to that, they would be provided with consultations, teleconsultations, to ensure that they're doing it right when they have such critical patients. We are also in the process of acquiring ventilators that we can dispatch to the various regions, working ventilators, that is, because in some of the regions they did receive earlier in the pandemic some ventilators, but they are not in working condition, so they've been absolutely useless to the doctors and patients in those regions. We are currently working to ensure that we get them working equipment that they can utilize if they have such a critical patients. And then, of course, the other thing that we are doing is to ensure that if we do get critical patients, how to do the medevac so that we can bring them out to Georgetown Hospital so that we can provide them with adequate care. So each region have its own regional task force. They go through the morbidity profile of the region on an almost daily basis. They come up with the medical response, and from Georgetown, the Health Emergency Operations Center would support every region, whether they need additional human resource, whether they need additional equipment, whether they need some help in doing a medevac. We play that supportive role as well. But every region, they have a team that is specially dedicated to respond adequately to the COVID pandemic in their specific region. And of course, you would appreciate that each region would have its own nuances, and so we are taking those local factors into consideration when we do that response as well.
Okay. In terms of regional response, I know Diamond Hospital is one of the main hospitals in Region 4. Do you have any updates on that facility?
Diamond Hospital, there have been a little bit confusion, I think, in the press. Thank you very much for that. It allows me to clear it. Um, Diamond Hospital, on the complex itself, we can divide it into two broad areas. One is the section that provides clinical services, the other section that deals with um, the isolation of patients. The component that deals with patient isolation is still functional and working. The component that has the clinical services, that has been temporarily closed because we have received funding from DFID and we are upgrading that particular hospital. It's part of a project called the Smart Hospital Project, and we are hoping to complete those repairs within the next month. And as soon as we finish those repairs, clinical services at Diamond would be up and running again. In the meantime, the staff that some of the staff that we had at the Diamond facility, we have temporarily deployed them to the Ocean View facility to join other staff from the Georgetown Hospital to provide care for the patients that we now have in the Ocean View facility. As you would recall, last week we had a number of teething problems in trying to get that institution up and running. We initially had 11 patients, now we are up to 24. And as the days goes by, you will see many more patients going to the Ocean View facility. So with Diamond, we should be back in operations on the clinical side within a month, and we'll continue to operate the isolation area for patients who need isolation.
Okay. Okay, one last thing. I know a lot of people are basically not taking COVID seriously. They don't understand the implications of it. Um, so does the ministry have planned in terms of campaigning and getting the message out there and reaching the everyday person?
Well, we have a number of strategies where we're trying to target different segments of the population. I guess we have to get more focused messages that are more focused on different age groups and things like that, because they probably might respond better with that type of messaging. We have brought some entertainers on board, and you would have seen or heard many more messages coming from DJs and entertainers. So we're trying to get to that younger, more mobile population group that feel that they're immune to this thing, nothing is going to happen to them, they're strong. But while a lot of young people might have a more asymptomatic or a mildly symptomatic presentation of this illness, when they get sick and they take it into their homes, they can affect older and more vulnerable people in their home. So one set of messaging is directed to the younger population, more mobile, active population. So we have been doing that, and we are very grateful to the entertainers and DJs who have been working along with us. Another set of messaging is directed at older people, because we have seen that older persons are more vulnerable to this disease, and we want to take the extra precaution so that they're not put at risk. And you would see with some of the other ministries as well, things like pension and so forth. We are now trying to change the system where we can get these things to older people rather than them having to come to some institution where they might be putting themselves at risk. Now, the systems that we have put in place are not perfect as yet, but we are moving in that direction to reduce the risk to these older persons, and that's another group of people that we've been working with. Another important group, they're persons who are at higher risk if they have other chronic non-communicable diseases and other diseases for that matter. So persons who are diabetic, who are hypertensive, and so forth, can be more vulnerable to COVID-19. And again, one of the challenges have been that since March of this year, many of the services that were offered by the clinics have been restricted because of general fear and all kinds of other things. Plus, medications and so forth were not available. We are now ensuring that we can reopen these services and provide the service in a safer environment so that these other conditions that people might have, they can be able to manage them properly. And also to educate those patients to take the extra precaution to reduce risk for COVID-19. So in that segmented approach and looking at the most vulnerable, I think that's an important way of getting over the message. If people understand the risk that is involved and take the necessary precaution, then of course they would be able to be much safer. In addition to that, we have some general things that we've been working on, looking at natural places where people tend to gather. So places like bars and rum shops and so forth. And as per the order, those types of activities are right now restricted under the order. We also know that mask wearing is very effective in preventing the transmission of the disease, and we continue to emphasize that because that's one of the most important weapons that we have in our arsenal. If everybody wears a mask and wear it properly and consistently, we will see a reduction in spread. And we want to encourage that. The law right now makes it mandatory for everyone in the public to wear a mask. And we want to ensure that people understand the reason why they need to do it. And I guess once they know that and they take those precautions, then all of us would be a little safer. So again, my appeal to everyone, we need to work as a team. We need to work as a country to prevent COVID-19 in Guyana. This is not one ministry or one person's job. This is everybody got to work as a team. And if we do so, we will be able to push back against this virus. We'll be able to reduce the spread of the virus. And ultimately, when there's a vaccine, we'll have better control over this virus. But this requires a lot of teamwork, and I'm appealing to everyone, play your role in helping us to reduce the spread of this virus.